Doctor, this is John Smith. He just turned 7 years old a week ago. He has been diagnosed with tonsillitis. He is in the operating room with us today to have his tonsils removed. Any questions?
Of course I have questions, you silly nurse. First, before I cut into this poor child, I need to know what led up to him requiring surgery.
John is a second-grade elementary school student. He is able to do all the things expected of a child of his age. His fine and gross motor skills have developed well. He plays baseball, rollerblades, rides a bike, and does extreme sports. His hand-eye coordination is so good that he was given the position of pitcher on his little league team. He enjoying doing crafts, playing Go Fish, and board games. He is learning how to read at school and his mom says he pays attention well in his classroom.
Well, that's great. But what does it have to do with his tonsillitis?
Oh, you wanted to know about him leading up to getting sick. Well, I am giving you his full history. The anesthesiologist is not here yet, so we have time to kill.
I see. Please stop dancing. This is an operating room, not a disco. Well, what else is there to know about him?
Sorry, doctor. I was just getting excited for the surgery to start. Anyways, John is hitting all of the physical growth milestones for his age. He is 3 feet tall. He has steadily grown 1.5 to 2.5 inches each year. He weighs 42 pounds. He should be gaining 3 to 5 pounds each year. He is in Erik Erikson's industry-averse inferiority developmental stage. This means he gets a sense of self-worth and achievement from his accomplishments. According to Piaget, John is in the concrete operational stage. In this stage, John is learning the concepts of conservation. He is learning how to understand cause and effect and reason.
Wow, he is learning a lot of things. Can we please talk more about his reason for hospitalization? How did you prepare him for his surgery?
Anytime I have a child as a patient, I try to talk to them and not just their parents.
How do you talk to a child about being sick?
I am glad that you asked, doctor. One of the first things I do is find out what the child thinks caused the illness. Then, only after I know what his understanding is, do I explain in simple terms the major body systems and how his illness can affect them. I want to make sure that I answer any question that they might have. I try to find out what experience my client has had with illnesses, surgery, and hospital stays. I want to know where my clients get their information from. Often, children want to know what other children like school friends or siblings know about the illness or surgery. This could lead to the wrong information being given to the client or may scare the child.
Interesting. Go on. I think I can learn a thing or two from you.
I use books, pictures, and toys to help educate my pediatric patients about their condition. I want them to feel as in control as possible because children who are sick tend to feel out of control.
And what do you tell the family? How are they supposed to take care of a sick child?
First, I encourage the child's parent to ask questions about their child's illness. I try to clear up any misconceptions that they might have. I try to give them information that will better prepare them for dealing with the illness. I want my patients' parents to be able to feel like they can provide their child with the care that they need. If their child is in the hospital, I encourage them to stay with the child as much as possible. Sometimes, it is necessary to provide them with coping strategies, financial resources, and community services depending on what their needs are.
It sounds like you are very helpful to your patients and their families. Now that I know a little bit more about them, tell me about John's tonsillitis.
As you know, tonsillitis is an inflammation of the palatine tonsils. It can be caused by a virus or bacteria. John shows symptoms that are typical with tonsillitis. His symptoms include multiple, recurring throat infections, breathing and swallowing difficulties, redness of the anterior pillars, and enlargement of the cervical lymph nodes. The tonsils usually appear large and swollen. All of these symptoms are listed in my maternal and child nursing care book.
That sounds like tonsillitis to me. What therapies and treatments were tried before he was scheduled for surgery?
John was seen in the office of his pediatrician many times. His doctor did a visual inspection each time he was seen. Because John had difficulty sleeping because of the tonsillitis, His doctor tried to use the temperature-controlled radiofrequency technique. With this technique, the pediatrician hoped to reduce the size of the tonsils. Antibiotics were given on multiple occasions when bacteria was present in lab cultures.
I am assuming these interventions were unsuccessful since we are scheduled to do surgery today. When the anesthesiologist arrives, he will put John to sleep using general anesthesia. After John is put under, I will go in and surgically remove his tonsils. Can you answer a question for me? Does John have any signs of fever, upper respiratory infection, or a sore throat?
No, doctor. John has not experienced any of these symptoms for over a week according to him and his mother. He was not given any medications that could increase his risk of bleeding in over 2 weeks.
Since I am a surgeon, I am unaware of what the nurse does for this illness. Please tell me what your responsibilities are.
I administer any post-operative medications to the patient. It is my responsibility to provide supportive care to my patient and his family. I help the parents and child get prepared for any surgeries and hospital stays. I encourage my patient to drink cool, non-acidic fluids to help with swallowing and to prevent dehydration. I encourage my patients to get rest and gargle warm salt water to soothe any throat irritation. For the parents, I always need to remind them how important it is for their child to finish all of his medications and antibiotics.
I bet that can be a big responsibility. I am glad that I do not have your job. Ha ha.
Well, it is a big responsibility, but I take my job very seriously. I thought there was no dancing in your operating room?
Yeah. I guess I did say that, didn't I? Well, I'm about ready to begin the surgery. Are there any other teaching points that I should know about?
Yes, I need to teach both the parents and my client about care after his tonsillectomy. Like I stated earlier, I will instruct my client and his parents to make sure he is getting enough cool fluids that aren't acidic. No orange juice or pop during the recovery period because this can irritate the throat and incision site. The parents can apply an ice collar to John's neck for comfort and pain relief. Tylenol or other pain medications should be used to relieve the child's pain. My pediatric client needs to know that his needs are important. I always tell him about his care needs and what to expect as well as his parents so that he feels in control of the situation.
Oh.
I will tell John that he might have ear pain a few days after his surgery. This is common in patients after a tonsillectomy and results from pain being referred from the tonsillar region. I will tell him that he can go back to school in about 10 days after his surgery, but that he shouldn't do any vigorous activity for the first week after his surgery. He needs to know that he will probably have a sore throat for about 10 days. It is important for him to tell his mom if he is having any pain or tastes blood in his mouth. This could be caused by a complication of tonsillectomies where there is bleeding from the surgical site. This should be reported to his doctor right away if he notices it.
That about covers it, doesn't it? You can talk forever about this kind of stuff. I am getting bored.
I am not intending to bore you or lecture you. It is just as important for you to know this information as well as John and his parents. There is one last important thing. John's parents should be aware that there is an increased risk of infection after surgery. They should keep an eye out for white areas on the back of the throat or odor within the first week after surgery. Monitoring John's temperature is also important. A low-grade temperature is not an indication of an infection, but a temperature over 102 degrees Fahrenheit should be reported to his pediatrician.
With you by his side, John should be well cared for. I am sure his parents will learn a great deal from you. The anesthesiologist is here. Let's begin the surgery. Please inform his parents that we are about to begin.
Thank you, doctor. I will let them know now.